Everybody, we are live. Welcome to the webinar online. We have been organizing in the framework of the joint action on increasing capacity building of national focal points. Today's topic are the funding opportunities in the framework of HERA and the funding programs ahead in the annual work program 2024. My name is Sandita Florea. I am part of ProMIS team. In this joint action, we are affiliated entities of the Italian Ministry of Health. The Italian Ministry of Health is the coordinator. We are a joint action funded under the third health program. Already this is the third year of the joint action, and we have been intensely working with colleagues from Europe, national focal points, in order to increase the capacity and support the implementation of the EU4Health program. So what I would like to mention is that, we are recording the webinar, and this is part specifically of the activities of Work Package 6, Capacity Building for National Focal Points. ProMIS is leading this work package, and we have been designed and implemented already a transnational training program, and online and on-site. So this webinar is strictly dedicated to the national focal points. It is not open to a wider public. However, of course, we have been sharing also the registration link through our colleagues, the national focal points nominated, to the dedicated stakeholders. So there are some stakeholders from Italy and the other member states, but they have been specifically invited by the colleagues. And if not any comment in the beginning, I think we can start. I just would like to remind that we have to keep our microphone off, and my colleague Riccardo Buttarelli will be assisting also today's webinar with regard to the technical part. And I think we can start. Give the floor to Angela Tessarolo at first, if I'm not mistaken, for the introduction. Thank you so much.
Thank you, Sandita, and good morning, everyone. Thanks a lot for the invitation. My name is Angela Tessarolo. I am a policy officer at HERA, and I am joined today by my colleagues Urska Molnar and Carlos Joao. The meeting will be a bit shorter than foreseen. I think we will try to keep it to 45 minutes, and we will present you the funding opportunities of the EU4Health Work Programme 2024. Before going into the details of the funding opportunities, though, I would like to give you a bit of a background about HERA and about our main activities. And then I will leave the floor to Urska and Carlos to present the grants and the procurement opportunities. So as you all well know, with COVID, the healthcare landscape changed a lot. And also there were several institutional developments also at European level. In these slides, you can see a bit how the security framework looks like at the moment at the European level. So the president of the European Commission, Ursula von der Leyen, started this new approach of creating a European Health Union a couple of years ago, and these results in several policy but also institutional changes, such as the reinforced mandate of the EMA, the European Medicine Agency, the reinforced mandate of ECDC, the revision of the regulation on serious cross-border threats to health, which kind of sets the basis of all the actions that the European Union is taken in terms of pandemic preparedness and response, and the creation, of course, of HERA. The creation of HERA happened in September 2021 with a clear intention. So what we observed during COVID-19 was the lack of medical countermeasures that were to be swiftly available. And that's why the main focus of HERA is indeed to ensure the availability and the accessibility as well of medical countermeasures. Medical countermeasures are medicines, but also medical devices, PPE, so gloves, masks, for instance, and all goods and services that are aimed at combating serious cross-border health threats to health. But how do we do so? How do we ensure that these medical countermeasures are available and accessible in case of need? Well, we try to work across the whole value chain. So from, as you can see in this slide, from intelligence gathering and analysis up to distribution and stockpiling, going also through research and development, clinical trials, the production of MCM, but also the procurement. And I will maybe spend a few words about this later. And this is also important to mention that we have several collaborations with international stakeholders from different sectors. Next slide, indeed. So here it is presented our budget. We have in a budget of 6 billion euro over a period of 6 years. So now we are in 2024, and until 2027, we have a bit more than 2 million to be spent. How do we spend the money? Basically, we don't have our own independent budget. We rely on 3 main programs, which are EU4Health, Horizon Europe, and RescEU. EU4Health, you all know very well that there was a reduction in the budget very recently. So the figure that you have in this slide is to be reduced a bit, but still it's our main source of funding, and we are really relying on EU4Health to develop most of our projects. In the next slide, you can see the main threats that we have identified in 2022, which are agents with pandemic potential, AMR, and CBRN, so chemical, biological, and radionuclear threats. And by identifying these 3 main categories of threat, we are trying to also guide our actions towards these 3 threats, basically. However, in the last year, in view of both, let's say, the geopolitical developments, but also the increased consequences of climate change, we thought that it was important to add 2 new categories. One is biosecurity. Let's say an example could be bioterrorism, and the second one is environmental threats. And here we look mostly at vector-borne diseases. And based on this threat prioritization that we try to indeed update every year, we have also developed a catalog of more than 500 medical countermeasures that we will need in case of an outbreak. Then under this catalog, we have then several subgroups. So we try to further refine the list of medical countermeasures based on the needs. So for instance, we have lists for stockpiling, lists that are more relevant for monitoring the supply chain, and also lists that are aimed at identifying products where R&D support would be needed. In the next slide, I will talk a bit about the intelligence gathering activities that we are supporting. We have 2 main categories here as well. The first one is about laboratory capacities. The second one is about digital capacities. But as you will see, they are very much interlinked. On the one hand, we support laboratory capacities in order to strengthen sequencing capacities. And this is not only done in Europe, but also in Africa. We also support activities linked to wastewater surveillance. And we have also created a network of laboratories, which is called Durable. It is led by the Institut Pasteur, and it aims at supporting HERA in basically identifying emergent pathogens and also ensuring the availability of medical countermeasures. How do they do this? For instance, by screening potential drug candidates. Still remaining in this field, in terms of digital capacities, we support Athena, which is a new platform that we are creating. The goal is to gather information and to evaluate potential health threats and related LNCMs, also by monitoring supply chains and to address shortages and vulnerabilities. We also support something that is already existing, which is IOS, the Epidemic Intelligence from Open Source platform, We are developing partnerships with several stakeholders, such as WHO, Africa CDC, in order to improve the digitalization of health data. And something that is actually very much linked to Athena, it's the project that is called EU-HIP. EU-HIP is a project that aims to improve the interoperability between member states' platforms and Athena. So that's work in progress, but we are putting a lot of efforts in order to make sure that data are interoperable. We know that this is one of the biggest problems when it comes to data sharing, and that's something that during outbreaks, it's very relevant. In the next slide, there is a bit of an overview about what we do on innovation. So as I mentioned, we have two main programs that we rely upon. One is Horizon Europe, one is EU4Health. Horizon Europe is mostly supporting early stage research, while EU4Health focuses more on late stage development, and by using EU4Health, we try to bring products to the market. And thanks to both programs, we have partnerships with several international organizations, with WHO, with CEPI, with GARPI, and others. Here in the slide, we also mention EIB, the European Investment Bank. That's because we are developing with them a very important action. It's 100 million action that aims to basically support innovation. To put it in simple terms, HERA Invest is a tool to basically de-risk private investment, as in case of failure, HERA Invest would cover the losses. So these 100 million have been already, let's say, allocated to 4 projects that are now being developed. And we hope that this tool will be proven efficient. In the next slide, we have a bit of an overview about what we do in terms of production, procurement, and stockpiling of medical countermeasures. You might have heard about EUFAB. EUFAB is a network of ever-warm production capacities that can be activated in case of a health emergency. So basically, there are production capacities that are used, but in case of an health emergency and in case a specific medical countermeasure, in this case it's vaccines, is needed, we can shift the production towards this new vaccine that needs to be produced. And here we are investing 160 million for up to 325 million vaccines per year. On joint procurement, this might also be something that you are familiar with. That's a mechanism that can be used to jointly purchase a given medical countermeasure. So the Commission can act based on a member state's request to purchase a specific medical countermeasures. That's what we use, for instance, for COVID-19 medical countermeasures, therapeutics, and vaccines. And indeed, we have several active contracts at the moment, not only for COVID-19, but also, as you can see in the slide, for pandemic influenza and for monkeypox. On stockpiling, that's a very important piece of our activities, as we have invested 1.2 billion euro under the Rescue program. We work in collaboration with DG ECHO on these projects, and the aim was mostly to stockpiling medical countermeasures for CBRN, so for chemical, biological, radiological, and nuclear threats. Last slide. Here I wanted to present you a bit of a new field where we are expanding our activities. In fact, at the end of 2023, the Commission released a communication on shortages, on how to address medicine shortages in the European Union, that had 2 main objectives. One was to prevent and mitigate critical shortages at EU level in a coordinated manner. And the second one was to assure the security of supply for the most critical medicines for the EU and the health systems. In practical terms, what we are doing at HERA is that we are trying to set up the so-called Critical Medicines Alliance that should basically develop a set of recommendations for industrial policy and for coordinated action at EU level against shortages of medicines. The focus here is really on a limited number of critical medicines those that have a highest risk of shortages and the highest impact on the healthcare systems. The work of the Alliance that is just starting now will pave also the way for possibly institutional changes and possibly also future legislative actions, for instance, the Critical Medicines Act that was mentioned several times in the past months in several discussions with member states as well. With this, I hope I gave you a clear overview about what we do, about what are our priorities, and I would like to thank you for your attention, and I will now give the floor to Urska for more information about grants.
Thank you very much, Angela.
So good morning also from my side. My name is Urska and I'm a new EU4Health project manager in HERA 02, working closely together with Angela and Carlos. And today I'm here to present to you the grant opportunities under the EU4Health 2024 work program, together with my colleague Carlos, who is here to present to you the procurement opportunities. So because of that, I would like to first start this presentation by briefly describing the difference between procurement and grants. Under procurement, procurement is following the procedure of call for tenders, and grants are following the procedure of calls for proposal. The main difference is that under procurement, we are buying, we are purchasing products or services, and under grants, we are giving money. Under procurement, we agree on the price, and the commission usually pays 100% of the price. However, the grants usually do not cover the total cost of the action. The result of the grants remains under the ownership of the beneficiary. However, having been bought and paid for by the Commission, the products or services under procurement remain under the property of the Commission. We sign a contract after we agree on the price under the procurement, and we signed a grant agreement. When it comes to grants, we follow the principle of profit under procurement and the non-profit principle under grants. So in general terms, so what is a grant? A grant is defined as a financial contribution or a financial support, and it is a direct payment made by the Commission to one or more beneficiaries for either carrying out an action helping to achieve union policy objective, and these are so-called action grants, or with the purpose to finance the functioning of a body pursuing objectives part of union policy, and these are so-called operating grants. So please know that today I'm here to present to you the 5 upcoming action grants that will be implemented by HERA. With the indicative call opening set for 23rd of May and the indicative deadline with 5th of September. These grants will be signed the latest in June 2025. Please know that there will be an additional info session scheduled for these grants where the colleagues who are working on the specific topics and have knowledge of the specific fields will be presenting to you these actions, and therefore you will be kindly invited to ask any specific questions on these topics in the next session. However, here today we are not answering specific questions as the financial regulation prohibits us to do so before the call publication, but we are pleased to answer some general questions at the end of the presentation, and we remain available for you in writing if you have any additional general questions. But we would also like to kindly invite you to consult the 2024 EU4Health Annual Work Programme, where you find additional details concerning these actions. So here is the list of the upcoming opportunities, grant opportunities under the EU4Health Work Programme. We will have a call for proposal on the European Hub for Vaccine Development, call for next generation respiratory protection, call to support innovative manufacturing technologies and processes in the Union for Medicine Production, call to support the development of novel antivirals, and a direct grant to member state authorities, support to the development of sustainable, forward-looking national and union stockpiling strategies. So as first, I would like to present to you our biggest call, which is a call for proposal under European Hub for Vaccine Development with the indicative budget of 102 million euros. So recent regional outbreaks, epidemics, and pandemics have shown that timely and large amounts of vaccines save millions of lives and ensure the recovery of economies and social life. Therefore, the manufacturing capacities in the EU should be paired with the best research and development capacities for vaccines with swift clinical trials and regulatory process. So the aim of this action is to establish a comprehensive European hub for vaccine development, merging research and development with industrial capabilities. So the main aim is to form consortia comprised of vaccine developers involving both publicly funded and industrial entities. As next, we have an upcoming call for proposal for next generation respiratory protection with the indicative budget of 20 million euro, as the fundamental role of respiratory protection is saving lives in health emergencies. And respiratory protection is critical in the early stages of outbreaks, that is before the vaccines and therapeutics are available. So this action aims and focuses on the development of next generation respiratory PPE. And the applicant should propose a detailed plan to design, prototype, validate, and CE mark innovative, cost-effective, and sustainable next-generation respirators. But they should also, very important it is, that they prove the feasibility for rapid production scale-up in health emergency. So the applicants targeted with this call are private and public bodies, active and with relevant expertise. As next, I would like to present you a call for proposals to support innovative manufacturing technologies and processes in the Union for medicines production, with the indicative budget of 17 million euro. So this action is supporting improved manufacturing technologies and processes that allow for a more effective, less expensive, easier to scale up, more sustainable and cleaner production of medicines. So innovation should allow for rapid scale-up of Union pharmaceutical production in health emergencies or to prevent critical shortages. And the applicants targeted under this call are economic operators and applied research stakeholders who can develop these technologies and processes. As last open call for proposal, I would like to present to you the opportunity to support the development of novel antivirals with the indicative budget of 10 million euro. Viral infections represent the biggest threat and pose a substantial economic and public health burden, and therefore antiviral development remains crucial to ensure timely and effective treatment of these infected individuals to mitigate virus transmission. So this action aims to diversify and advance the pipeline of broad-spectrum antiviral candidates. And this call targets private, academic, and public bodies, active and in the field of innovation and with adequate expertise in drug development. So as last, I would like to present to you support to the development of sustainable, forward-looking national and union stockpiling strategies. But I would like to mention that this action does not follow a regular open call for proposal, as it is a direct grant to member states authorities. So a direct grant is awarded without a call publication. The grant follows a very specific procedure which allows the member states to nominate the relevant competent authorities who would be in charge of the implementation of these actions. And here I can mention that the deadline for this nomination is the 25th of April. But if you are involved in this action, you will be also invited to the practical workshop for now foreseen after the call publication with the indicative date of 28th of May. So member states will need to align the national strategies developed through these direct grants with the union strategy on the stockpiling of medical countermeasures, including critical medicines. And the Commission and member states should develop a common strategic approach to member states to stockpiling. And here I give my floor to my colleague Carlos. Thank you.
Thank you, Urska. Thank you, colleagues. Good morning. No need for introduction. So my name is Carlos, and I'm working with the colleagues in the EU4Health program in HERA. And I will present briefly the procurement that we have in hand under the EU4Health program. And my apologies if we are reiterating a little bit the message on between the difference between grants and procurement. But we realized over the years that it's difficult to reach some stakeholders and make them aware of the procurement opportunities. And this is usually the case when we are talking about public institutions or academic research institutions that are more used to the grant model, maybe because they have participated in previous calls for proposal under Horizon or under EU4Health, but sometimes they miss some opportunities also for the procurement, And therefore, I would like to emphasize here that your role is very important for us as national contact points for EU4Health to promote also these procurements and to promote the opportunities for market operators in your countries that can explore some business opportunities here also with procurement. So I brought here 2 paragraphs from the financial regulation and the VADEMECUM that really, let's say, describe what are the procurement and what we are looking for. Especially in HERA, we don't really look for works, but we really look for supplies or services that allow us to implement our mandate. So all the scope of activities that Angela just described that HERA as under its mandate, we operationalize that mandate through the grants, but especially through the procurement. And so the chosen of the procurement rather the grants is because sometimes we are contracting authorities, we need to own the results of the outcome of those activities, but also we want to increase our chances of having better solutions by having those solutions provided by the European Union entities that work in the field. So having solutions that are really coming from the state-of-the-art developments rather than in-house solutions that we could also develop. So there are different ways of implementing procurement in the field. I just brought here 3 examples of things that we have done in the past and they will continue to do in the future. So usually the most common is open procedures, but we also have competitive procedures and negotiated procedures depending on the cases. And we usually do direct contracts, but as you will notice from the opportunities for 2023 and 2024, we are designing several framework contracts and then requests for service under those framework contracts. So this is the most typical ways of implementing procurement, are not the only ones, but are the most used that you should be aware of. So next slide, please. So our procurement as based these 4 categories of our mandate. So we have activities or actions for intelligence gathering. We have actions to support innovation and development of medical countermeasures in a specific setting, in specific niche, addressing specific needs of the EU. Then we have also actions that will allow us to purchase the medical countermeasures in case of need, and this is especially relevant for the emergency cases. And we also have actions that aim at promoting the availability and accessibility to medical countermeasures, namely to antibiotics that might be in shortages or for where there is an increasing need in Europe. So next slide, please. So before I talk to you about the 2024 opportunities, I thought that this was a good moment to still introduce you to the 3 opportunities under the 2023 for things that are still running and open, and 3 actions that will be crucial for the 2024 activities, because some of the activities that we are going to launch in the future are underpinned under these 3 actions, and these are related to the framework contracts that we are still launching this year. So the first one on your left is the support to the Commission on identifying priority threats and medical countermeasures. So this will be a framework contract that will support us in our intelligence gathering activities on the public health threats and medical countermeasures. And the idea is that when we have as we still have some limited capacity on gathering intelligence on both priority threats and medical countermeasures, when a need arises, we could launch a request for service under this framework contract to support our intelligence gathering. So this year we are launching this framework contract. We will give the opportunity for the markets to submit offers to see what are the best players in the market that could support our activities, and then we will establish this framework contract in cascade. And in the next year, so for 2024, 25, 26, we will launch requests for services using this framework contract. So please promote this framework contract as best as you can. I'm sure that within your countries you have a lot of players in the field that could meet the criteria under this framework contract. We will be sharing this slides, so you will be able to quickly find the links in funding and tendering for these framework contracts, and further promote the framework contract. So passing to the second one, that is still an opportunity opening for the support innovation and access to antimicrobials. And here we are targeting tuberculosis pediatric formulation. So a little bit adaptation of solutions that are already in the market, but focused on pediatric, with a pediatric scope. So this is a open call for tenders with a budget of 5 million that is still open, and I think it's also a good opportunity for manufacturers, producers, and also researchers in the EU that are working in this field to be able to submit an offer and work with us on that. And the third opportunity that will be open soon, although I cannot yet advance with the date, but is the continued support to existing wastewater activities, including the establishment of a new Sentinel system. So as you saw on our mandate presented by Angela, one of the areas that we are investing is our laboratory capacities in the EU, and wastewater-based surveillance is one of our big, let's say, bets for now, to detect emergent pathogens, antimicrobial resistance, so everything that is related to our core mandate on our three main public health threats, so CBRN, antimicrobial resistance, and emergency pathogens. So the idea is a little bit the same as the framework contract on intelligence gathering. So we will launch a framework contract here, and in the upcoming years, we will launch several requests for service under this framework contract, so to support these wastewater activities and the sampling of wastewater. So again, a good opportunity for several economic operators in the market to already participate in this framework contract and work with us in the upcoming years. So in the next slide, and my apologies because on the slide it is 2023, but it's now 2024 opportunities. These are the headings that you can also find in the annual work program 2024 text, and you will have in detail what those actions mean. But you based on what I just described from 2023 opportunities, you will see that 2024 is a little bit of a continuation of those activities. So on the part of the MCMs, the left part, EUFAB, the action on EUFAB is a request for service that we will launch under the framework contract is already established. So we have this EUFAB contract, framework contract already signed. It is working, and every year we assign a specific budget to maintain that ever warm capacity working. So this will happen again in 24, and it will happen again for sure in 25. You will detect that there is an action in the annual work program called Purchase Innovation and Deployment of a Medical Countermeasures in Emergency Situations, and there is no budget allocated to this. So this is a line on the action on the annual work program that will allow us to be activated in case of need. So, for instance, in the case of the monkeypox outbreak, we use exactly this entry in the annual work program to purchase the monkeypox in that emergency situation. So this is the kind of action that we hopefully will never activate in the near future, but we need to have it in annual work program in order to use it if we need to. Then we have two activities that are still being drafted, and I cannot disclose more, but that we hope that towards the second quarter and the third quarter of the year, there will be some developments on that. And this is the the actions that where we target innovation. So speeding up innovation to bring some medical countermeasures more close to the market. So usually these involve clinical and non-clinical activities that will allow moving, products in the pipeline of development for early stages to later stages of development, hopefully with a submission also for market authorization. So these two actions aim to that. One is more focused to general medical countermeasures, and the other one more focused for the critical medicines and antimicrobials, as is also under our scope of activities. We also hope to leverage from the knowledge that we get from the Critical Medicines Alliance and the identification of what are the critical medicines that we need to support in Europe. So these two actions will also have into account the results of those works. So please keep your attention on those, because there might be good opportunities here also for economic operators in Europe. And lastly, I will be mainly targeting here our actions on intelligence, and you can see that these are linked to the previous framework contracts that I was speaking about on 2023. So the first one, intelligence gathering, and the second one, the global wastewater sentinel systems. These will be requests for services that we will be launched under the framework contracts that we are now launching and that we'll be signing before the end of the year. Lastly, and this is an action that we will have in principle every year, that is trainings. These aim to improve the capacity of member states in managing medical countermeasures. So we are talking about capacity building programs, exchange programs, specific models, specific teaching models on medical countermeasures, and from development to the regulatory to stockpiling. So it's a comprehensive training that is being designed. So over the next years, we will have several requests for service, several trainings that will touch a bit on what I just described, in order to improve the capacity of the public health force in Europe when emergency comes, and then we have a reinforced capacity to reply to that emergency. So for 2024, that's all. And again, I would like to a little bit to reiterate the fact that even if there are been some cuts on the EU4Health program, this doesn't preclude that our ambition still remains a little bit the same. We're still looking to work in all the areas that our mandate allows us. Maybe with the range that we would look like, or we would wanted to, but we will still be reinforcing and acting in all areas that the EU demands that we need to. So this is the message that I would like to end with. There are a lot of opportunities on the procurement again, and we really count on you to really promote, as I mentioned, it's an increased difficulty to reach the right stakeholders to reply to this call for tenders or negotiated procedures, for instance. Thank you so much, and I'm happy to take any question that you might have. Thank you.
Thank you very much, João and colleagues. It was a very comprehensive and into details presentation, and I think it was really useful for us for the first time. So there was a question in the chat that has been answered by Urška. Kindly, thank you. Colleagues, please go ahead. You can raise your hand or write in the chat. If in the meantime, I have maybe a question or a comment, again, just to, let's say, explain better the context, maybe for the colleagues that they don't know us so much. Last year, we had some interactions with Angela specifically and other colleagues, because in the framework of the joint action, we also have a dedicated task on the interactions with EU institutions and in the view of actions that we can take and support the implementation of the program. This task is led by France, and I think the colleague is also connected, so she can intervene if needed. And let's say we had a few interactions. We also have elaborated a dedicated deliverable. We mapped the, let's say, EU institution stakeholders, if we can say like this. And it has been already highlighted that focal points can support at the national level the implementation and promotion of the program. So, and in this case also of the HERA opportunities. Again, what do you think that we can do more as national focal points? We are representing mostly all member states and also associated countries of EU4Health. So our network is increasing, and I think, we confirm our availability to support. But if you have any other comment, request, maybe.
Thank you, Sandita. I would like to thank you for the great collaboration we had so far. I think it was very useful to be able to share with you the opportunities. And I think on the way forward, if we can just continue the way we worked in the past. So as soon as a new opportunity becomes available, we are happy to share it with you, and we'll be very glad if you could share it within your networks, not only with the national focal points, but also within the national networks that all national focal points have. So this is very helpful for us, and I think it allows us to reach more stakeholders and make our funding opportunities better known at national level. So many thanks again, and I hope we can continue on this path.
Thank you, Angela. Indeed, we have also had some exchange regarding specific calls, deadlines, and we try to be updated, and we always share. We have our database with the national focal points. Immediately the information is reached out, and colleagues are also active at the national level. So we hope to continue collaborating in this way, and of course to promote the opportunities and to follow also the informative communications from the Commission. Colleagues, any other questions? Please go ahead. If not, maybe, after you will share the presentation kindly with us, perhaps we can come back to you if needed. And soon we will be organizing our consortium meeting in presence, and perhaps also other discussion will be raised up, and so in proximity also of the call opening. Okay, so if not further question, colleagues, I think we can, 45 minutes webinar, we can close the session. Again, I remind it has been recorded, so you can see it again, and also we will have the report and the presentation. Thank you very much for participating. It was a wider participation, almost 70 colleagues from Europe, so thank you very much and have a nice day.
Thank you very much for having us. Have a nice day.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.
Thank you. Thank you. Bye.